Well, tonight, South Carolina is reporting 13 more measles cases across the state, and that brings the total for this outbreak to 933. And in response, State Senator Margie Bright Matthews is proposing a bill to eliminate religious exemptions for measles vaccinations.
It's a move that's drawing both support and criticism, as you might expect, from really across the entire state. WCNC Charlotte's Miles Harris joining us live in Fort Mill with the latest on this bill from South Carolina. Now, Miles, there's a real cause for concern here, it would seem, especially for those with small kids.
Yeah, you're right there, Colin and Vanessa. Now, the rise in measles cases now has South Carolina lawmakers stepping in with this new proposed bill in efforts to increase public health in the hope of keeping our communities safe.
The goal of the bill is simply to protect children and stop the spread of measles in South Carolina.
Health officials say measles cases are increasing statewide, raising concerns about vaccination rates. South Carolina Senator Margie Bright Matthews proposed legislation that would end religious exemptions for the measles vaccine for students in K-12 schools and child care settings.
Basically says that if you as a parent choose not to vaccinate your children, that is your right. But in exchange for that, you cannot send your children to public schools and public entities to allow them to infect other children with measles.
A controversial change in a state that has long allowed broad exemption policies.
Our job, my main job, is to educate parents.
Pharmacies in Rock Hill say questions about measles and vaccines are increasing. As measles cases tick up, pharmacies like Prime Family are setting up as an education frontline, helping inform the community about vaccination and prevention.
Whoever wants to know, as far as they're interested in getting to know about the vaccine, we do educate them. That's our job.
Senator Matthews stresses the goal of the bill is to increase vaccination rates and limit the spread of measles.
I plan on reminding them every time we have new cases in South Carolina. I plan on writing and requesting that my bill receive a hearing before the committee.
Colin and Vanessa, the bill and that conversation now moves to committee, and health leaders in both South and even in North Carolina continue to urge families to stay up to date on their vaccinations. We'll have more of the details surrounding this bill at 7 o'clock, but for now, reporting live here in Fort Mill, I'm Miles Harris, WCNC Charlotte.
Well, Miles, the numbers are really interesting here. We know herd immunity, the vaccination rate has to be around 95%. We're seeing some of the schools at the center of this outbreak had high rates of religious exemptions for vaccinations, including one school that had a 17% vaccination rate, so quite low compared to the herd immunity rate. All right, we'll see you soon.